In 2017 compared to 2018, we've actually seen a pretty significant increase, 25% increase between 2017 and 18.
Suicide. It's heartbreaking, and there are many things we can do to prevent it. Jackson County's Mental Health Department works hard to implement prevention strategies in our community, including education, intervention, and to support those affected when suicide does happen.
Hi, I'm Bill Mantz with Jackson County Close-Up. We're here today with Kristen Fedek. Kristen is the Suicide Prevention Coordinator at your Jackson County Mental Health Department, and she's here to talk about something that has really been in the news a lot lately, and that's suicide here in Jackson County. So thank you so much for joining us.
Yeah.
So suicide is often really difficult for all of us to discuss, and probably even harder to understand. So can you kind of give us an overview of what you're seeing in relation to suicide here in our county?
Yeah, so in our county, we've kind of seen over the years, we've had higher rates than the national average. But in 2017 compared to 2018, we've actually seen a pretty significant increase, 25% increase between 2017 and 18. And that's pretty significant. But there's a lot of different prevention efforts that are going on and things and resources that we have here locally. So a lot of effort is going into letting people know that there is help and hope.
Kristen, tell us about the Suicide Prevention Coalition and how they're fighting to reduce suicide here in Jackson County.
So the biggest part is getting community members together and talking about the same thing. We have mental health professionals, we have social workers from the hospitals, we have school counselors, teachers, any people in the community that are interested in being part of the prevention piece of things here. We all get together and we talk about what trainings are going on, what's the best practices that are coming out, because those are kind of being updated here and there. And there's a lot of the people on the coalition have actually been personally affected by suicide, so it is close to all of our hearts.
What's something probably really important for the general public to really know about suicide?
That it's one of the most preventable causes of death. And that's something that a lot of people may argue with, which is completely okay, especially if you've been affected by suicide. But it's something that we need to have human connection, and that's the biggest part. So that's something that we are working on in the community, and having people get trained is one of the biggest things that we can do to prevent suicide. So we train all the way down to age for 6th grade is the youngest, and then anybody else in the community.
So how do people plug into to getting some training?
So they can contact me directly, or we also have just mental health. They can call the mental health number and then be connected to me. So I do a lot of the education for suicide prevention, and then also can help businesses learn how to kind of develop policies and procedures around when identifying someone who's at risk, and then what do we do with that, and then knowing kind of what we do in our crisis department. So I kind of do a lot of pieces of that.
I know that there might have been kind of a recent change in the last couple of years with teen suicide specifically that might show that some of this is working. Can you share that with us?
Yeah, so we're seeing a really significant decrease, which is great, in 18 and under population. So for the first time since 2010, we didn't lose any 18 and under youth in our community. And that really, I think that's attributed to how vigilant that staff are at schools. Parents are kind of getting more aware of what's going on. The trainings specifically given to in classrooms and health classrooms to middle school and high school students. People are talking about it in a positive way, and how do we help and how do we get them to the resources, and that's making a difference.